experience at the federal, state, and local community levels. He has held leadership positions in local nonprofit agencies, state government departments, and national juvenile justice advocacy groups, along with appointments to an array of other boards, commissions, and advisory committees. And it goes on. So Dr. Jenkins, and you can find all these people on the website if you want more information on them. Thank you very much.
Thank you. I'm happy you can't find me in the FBI file. At least not that I know of anyway. I'm going to talk very quickly about 4 policy points and 7 recommendations. So if you were quick enough on the draw to pick up this handout on the table, you can slip out of here. Well, you got to hear her next, but you can at least get ahead of what I'm going to say. But I do want to thank Congressman Scott and Cardenas for hosting this briefing today. Really appreciate the attention to the conversation about prevention science, and especially translating prevention science into policy. It is critically important that we have this conversation, and the vision and the efforts that you have, Congressman Scott and the others around this, it's phenomenal. He doesn't remember, but Congressman Scott has carried the water for JJDPA reauthorization for many years on the House side in a lot of different ways, along with some other colleagues in the Senate. I used to work with his staff back in 2007 to 2009 when I was chairing the National Coalition for Juvenile Justice, and have always found his office and his staff to be extremely responsive to the needs of at-risk children. Really want to appreciate him. And the coalition as well, having the opportunity to talk about juvenile justice in the context of translational and prevention science is an awesome, awesome privilege, and I just want to thank Neil and Denny and Faith and the rest of the group for bringing us here today. So we're going to just fly through these, and I hope you don't get arthritis from clicking on the slides. Go ahead if you will. But I think I do a lot of community work in the South, and I spend a lot of time in churches, and I almost want to have a call and response with you guys, because I know we're talking to the choir. So these first few slides are all things that you know, and so I'm not going to belabor them. Crime is down, and I would say that in a large measure, one of the reasons it's down is because we've learned a lot more in federal, state, and local partnerships about what to do with at-risk and kids coming into the juvenile justice system, including their families. So it's a moment of celebration. Violent juvenile crime on this graph is down. This is a study by Jeff Butts at the John Jay School in New York. But the fact of the matter is all over the country, juvenile arrests are at some of their lowest points in the last 40 years, 50 years. And so there's something about why that is occurring. Next one, Denny, if you don't mind. Paralleling these data is the notion that not only is crime down, but we're locking up fewer kids. Now, you've heard already from all the speakers so far that the United States incarcerates children 5 times the rate faster than the nearest developing country. We have clear data on that. So even though this is good news, the data that you've heard from the former speakers are in fact not good news. We're continuing to incarcerate and institutionalize kids, and in a large measure, kids of color, at rates that are embarrassing for our country. We ought to know better. We ought to know more effective strategies for what to do about them. I broke all the rules of doing these PowerPoints. There are way too many things on them. That's why you need the handout. So I'm just going to fly. But you hope that it's going to live on a website and you'll have time to study it later on. So there are a couple things I want to say about it as we fly through them. As budgets contract and governments evolve, the real strength of juvenile justice is going to happen at the local level. Administrator Listenby is very fond of saying, and he's exactly right, the vast investments in juvenile justice happen in the community. They don't happen at the federal level. The federal investment in juvenile justice is almost embarrassing. When you think about the number of the billions of dollars that happen in juvenile justice in this country, it's predominant, 95% of it is state and local dollars. And so the federal role is really about being a standard bearer, setting a standard of excellence around what ought to work and how to leverage resources across these different layers. And it is about effective federal leadership, which is my focus. I've been a clinician and a policy person and an administrator and a state government bureaucrat. So I'm coming at this conversation as a former state advisory group member and a leader of state advisory groups. And I've had the benefit and the pleasure of not only chairing my state advisory group in North Carolina, but also leading the national coalition. So now that I have these experiences, I can tell you the state advisory groups are hungry for leadership in these issues. They're asking for effective translation and prevention science all over the country. And here's why, if you look on this slide. Incarceration exacerbates children's behavior problems. It's well documented that if you put the wrong kids in the wrong circumstances or you treat them with the wrong program, not only do you have a chance of not helping them, you have a real high chance of harming them. And when you do that, you also exacerbate the fiscal consequences of their lives. These data show that you can end up, a child untreated or mistreated can end up not only costing themselves, but our society as a whole, somewhere close to $2.5 billion in their lifetime, between lost opportunity costs, lost education, tax dollars, and all the things that children eventually become engaged in. Next slide. Prevention science has principles, though, that when married with federal policy can change all that. And you heard Congressman Scott talk about that earlier. We know from experience and from our research how to fix a lot of these problems. The trouble is that we can't get past some of the sort of historical way of thinking about these things or some of the political benefit of doing things in the short term. But if prevention science in this policy point, if you think about prevention science and what it offers, it looks at holistic community solutions, it looks at children, family, communities. Dr. Catalano talked about this earlier. There is effective prevention language already in the JJDPA Act. I'm here advocating for stronger translation prevention science language and stronger infrastructure in the federal government around how to make that work. And we're going to talk about that in just a few more minutes, if you will. This next policy point is something that if you have any experience on the ground in any state, these things will help you, will resonate with you. State advisory groups would be happy to do prevention if they, one, had resources. Their federal resources for Title II and the other JJ resources over the last dozen years have been cut in half, better than half. And so state advisory groups say, look, we hear you about evidence-based programs, we hear you about prevention, we just don't have the wherewithal to do it. And the wherewithal is not just about money, it's about training, it's about the infrastructure, it's about the quality management and the quality assurance, it's about the technical, on-the-ground resources that people need to do this work. And so they're at the table and they're saying, hey, we'll be your partner, just give us the resources to do it. So all these other things, infrastructure, knowledge, strategies at the federal level. One of the really important things that have happened recently, in 2013, the National Academy of Sciences put this wonderful report out about transforming and reforming the juvenile justice system in a developmentally appropriate way. That sounds really good. We talk about youth development, positive youth development, we talk about risk prevention, we talk about using evidence-informed risk assessments, all these things. But there's not a structured set of guidelines, practices, blueprint for how state advisory groups can make this real in their states. And there's not resources at the federal table to sort of transfer this technology. And so we're putting a lot of really good stuff in thoughtful policy documents or white papers, but we're not transferring the practice in tangible ways. And we've got to figure out a way how to do that. There's also a bit of an imbalance in focus. And I want to say that I'm a big fan of OJJDP. In years past, I've really advocated. They are our flagship organization in this country. Their leadership is critical to how we do federal juvenile justice policy and practices in the country. But they're playing with a cut deck, and they're between earmarks and reductions and political things going on over there at OJJDP. They've been thrown off balance in terms of the big picture about what prevention has to look like in this country. And what that translates in the states is that if you're a state advisory group chair and you're saying, we hear you, Administrator Listenby, we want to be developmentally appropriate, we want to do prevention, we want to stop kids from coming in our system, but we don't really have tools coming out of the federal government to help us shape our state advisory groups in ways that formulate that policy. We don't have the money to deliver that on the back end, and we don't have the technical expertise in our state advisory groups to make it so. And so those are really the things we're going to have to pull off at the federal level to make this real. Go ahead. So here we go with the recommendations. Invest in building prevention strategies, prevention expertise, and technology transfer at the federal level. That sounds simple enough, doesn't it? It is, in a large part, an investment strategy. If you do any reading in prevention and translational research, you realize that if you do it well, the cost benefits are extraordinary. You get returns of $8, $9, $10 for every dollar you invest in high quality prevention. You would ask yourself as a taxpayer, why in the world are we not doing this? If you went to the physician and your child were diagnosed with an illness, and the doctor said, well, we can give you this treatment, and it's way cheaper, and that's really good on your pocketbook. But we're not sure that 5, 10 years down the road, that treatment's really going to be effective, and in fact, it's possible this treatment could harm your child. But we also have in our toolbox a treatment that's about, I don't know, $5, $6, $8 more or $10 more, and we're pretty darn sure that it's going to be way more effective, but you're going to have to pay more upfront to deliver it. Which one would you choose? Exactly. You choose the most effective one that would have the greatest potential for helping your child. Why? Because you have an investment in your child, but you also have an investment in effectiveness. That's the value we're seeking to install in the JJDP Act through reauthorization. And we're going to continue to pound that table trying to get somebody's attention about that. In a reauthorized JJDP Act, we need to strengthen the expectation to require effective prevention strategies, prevention science and principles in the state's 3-year plans and whatever the planning cycle is going to be, and updates, with the caveat being that OJJDP has to be at the table in terms of providing the expertise and the training to make it so. We cannot expect states to deliver something that they're not being resourced to do. Now, part of the resources is not federal money. It's human capital, it's state finding sort of untraditional allies and partners, including universities, private investors in philanthropy, and local dollars, leveraging those services at the local level. One other recommendation on this slide, transform OJJDP state related, whatever they're calling that, the way that they operate and support states, to not just think about compliance activities. Now, I know they do more, but the perception in the states is often, if I don't comply with the Act and the 4 core protections in the Act, I'm going to lose my money. Well, what if we change their value system to say, if we don't build an effective prevention infrastructure in the state, then we're going to find a way to help you get that done, because by investing in that prevention infrastructure, we're all going to get greater returns on our investments, and we're going to eventually be able to turn the leadership of that prevention system over to you. The federal dollars may in fact be shifted to much more cost-beneficial programs down the road, and states can learn much more about how they can deliver these services on their own level without having to rely on federal investments to make it so. Yes. Dr. Aldridge and his colleagues at the National Implementation Research Network brought a briefing back in January to this very conversation, and he talked about the enabling context. This is a similar situation to what you've heard from the other presenters today. In order to change the climate and the culture of federal agencies and the state advisory groups, we've got to create the context in which to make it so. And these are just a lot of the elements that we've talked about in the policy papers and the handouts that we're giving you, so I'm going to move on. But most importantly, we've got to figure out a way in the federal budgeting system and in the administrative rules of OJJDP to allow the flexibility and the incentives to make this happen. Because if we just keep funding 3-year planning and core protections work, we're only going to get 3-year planning and core protections work out of the JJDPA. So we've got to create incentives, whether it's competitive grants, whether it's race to the top type situations, waivers. There are a lot of different ways. It may be public-private partnerships, it may be third-party philanthropy, but we've got to find a way to incentivize and motivate states to build prevention infrastructure so that they have skin in the game and they make this happen. Thank you, Congressman. So I've taken the liberty to construct a new OJJDP for you. This is a way oversimplified version of what typically happens when a law is passed, and you can see this when this ever gets put on the web. But basically, Congress passes a law, it goes down to the federal level, to the agency level, they develop rules, regulations, and then in OJJDP's case, eventually they get to the point where they say to the states, your money's ready, here's an RFP, here's what we need you to do. The states compete for that money, and if it's a good application, they get it, and then starts the cycle of delivering it and getting results back for compliance monitoring. And OJJDP does a lot of other stuff. They work with the coordinating council, they do training and development, and they do a lot of support to the states through technical service providers. So I don't want to minimize that. But in terms of the appropriations and the outputs, this is very similar to what the prior speaker spoke to. But if you go to the next slide, if we really saw a new OJJDP, all these services on the left that you can't read about have to do with installing new technology, new human capital, new prevention and translation science capability at the administrative levels of OJJDP, so that they're not only evaluating states' implementation of prevention science, they're evaluating themselves, or an outside evaluators coming in saying, look, you're getting this right. You're creating an effective framework for translating this knowledge down to the state level. And if you do this, I've used this example of disruptive innovation. Clayton Christensen, who's the guru of disruptive innovation at Harvard, has made a living talking about how new products get brought to market in more cost-beneficial ways because consumers and people at the lower end of the spectrum don't have the luxury of waiting for these higher-end products and these more complicated processes to bring these things to market. If you teach states how to do effective prevention frameworks in the way that we're talking about, not just me, but all the folks here today, I firmly believe that this theoretical approach would apply